Do you love caffeine? Do you look forward to the taste of hot coffee in the mornings or an ice cold Coke when it's hot outside? Are you addicted? After intense research, I gained insight on a few of the hidden dangers of America's #1 drug. Caffeine is a highly addictive drug that has a number of effects on your body physically, mentally, and emotionally. What exactly are these horrible effects? According to the U.S. Food and Drug Administration, about 90% of the world's population ingests some form of caffeine. In the U.S., about 80% of us take in caffeine every day. As stated in the book, Caffeine Blues, which was presented by Southwest Mississippi Regional Medical Center Auxiliary, caffeine contributes to palpitations, panic attacks, hypoglycemia, gastritis, fatigue, insomnia, and PMS. Also, neurologists document changes in brain biochemistry. Researchers even identify correlations between caffeine intake and certain kinds of cancers. Endocrinologists acknowledge that it contributes to adrenal exhaustion. Cardiologists report that caffeine also raises blood pressure, increases homocysteine, a biochemical that damages artery walls, promotes arrhythmias, and constricts blood vessels leading to the heart. Caffeine is very addictive, and without it, some people even develop severe headaches. Caffeine in large amounts may interfere with absorption and metabolism of calcium, which can contribute to bone thinning or osteoporosis. Caffeine also raises the amount of acid in your stomach and may cause heartburn or an upset stomach. An overdose of caffeine may cause a rapid or irregular heartbeat and breathing trouble. This is an EKG of someone's heart who drinks caffeine every day. As you can tell, it's racing very fast and it's very irregular. Another problem is that it takes about 5 to 6 hours before half of the caffeine you have ingested wears off. For pregnant women, caffeine travels within the bloodstream and crosses into the placenta. Since it is a stimulant, it can cause your baby's heart rate and metabolism to increase. Too much caffeine can cause a slowed fetal growth and an increased risk of miscarriage. Also, this drug is bad when breastfeeding a baby. It leads to irritability and poor sleeping for the baby. Caffeine does not stop there though. There are many emotional and mental effects as well. Chronic caffeine ingestion may cause anxiety and may be associated with depression and an increased use of anti-anxiety drugs. Caffeine may aggravate the symptoms of premenstrual syndrome. Individuals who consume moderate to heavy amounts of caffeine may develop caffeineism, and they may show signs of caffeine withdrawal syndrome after abstaining from the drug. Research shows that subjects asked to perform auditory recognition tasks, for example, where they had to process verbal information, did worse after ingesting caffeine. Caffeine increases blood pressure in the brain, leading to an increased risk for stroke. As stated in Caffeine Blues, if a person was injected with 500 milligrams of caffeine within about an hour, he or she would exhibit symptoms of severe mental illness. Some of these symptoms include hallucinations, paranoia, panic, mania, and depression. I would like to conclude with these remarks. Caffeine causes a lot of trouble within our bodies, but it is not too late to cut back on the amount of caffeine you consume on a daily basis. Hopefully this speech caused you to really think of the permanent damage caffeine is doing to your bodies. Just know that even though you love caffeine, you do not have to stop drinking it. You just need to cut back on the amount of caffeine you intake on a daily basis. Remember, this is one of the few things you have complete control over, and it is up to you to not let it go too far. Thank you.